Will a poorly moving scapula really cause shoulder pain? Find out in this episode of Monday Mornings with Michael. So first, let's talk about the scapula. The scapula is also called the shoulder blade, and it sits on your back just on top of the rib cage. The only bony attachments that it has to your body is actually on the AC joint, and so the acromion process is actually a part of your scapula, and so it attaches onto the clavicle. Other than that, it's only muscles that hold the scapula in place. Whenever we talk about muscles and the scapula, there's three main muscles that we talk about. It's the upper traps, serratus anterior, and the lower traps. When those three muscles contract, they cause upward rotation of the scapula. So if this is my right scapula, when those three muscles contract, they cause it to upwardly rotate. So if I'm doing any movements up overhead, those three muscles should contract to help upwardly rotate it to provide the foundation for the arm. The traditional thought was for every 2 degrees of movement from the arm, so actually the glenohumeral joint, there should be 1 degree of movement coming from the scapula. And so if we're doing overhead movements to get all the way overhead, there would be about 120 degrees coming from the actual shoulder joint, and then the other 60 degrees would come from the scapula. The idea is that if there's poor movement in the scapula, that will cause shoulder pain. And so what we'd be looking at is those three muscles that we were talking about before, the upper traps, lower traps, and serratus anterior. And if there was an imbalance between how those muscles activated, we would have pain typically with overhead movements of the shoulder. For example, if we said someone had an overactive upper trap, we would say that instead of upwardly rotating the shoulder blade, we would have more of a shrugging motion, which would lead to some sort of pain in the shoulder. Another example would be a weak serratus anterior. So again, instead of upwardly rotating the shoulder blade, we would have winging, which means that the inside border of the scapula would actually come off of the rib cage. And we would say that, the reason why you have shoulder pain is because the serratus anterior is weak, therefore you have instability. Well, logically, this all makes sense that if we have a poorly moving scapula, that could be the reason for shoulder pain. It's really not all that clear. One of the reasons is because the movement of the shoulder blade is really context specific. For example, let's say that we're just simply raising our hand up overhead. You're going to approach that movement differently than if you're going to do an overhead press with a lot of weight. So in some cases, when we were just raising our hand up overhead, we might have either a shrugging motion or a little bit of winging, but then we load it and all of a sudden that dysfunction went away. Of course, we could say the exact opposite and say that without load, there's no winging or no shrugging of the shoulder, but then as soon as we load it with either an overhead press or even just picking up our kid off of the ground or something like that, then all of a sudden, now we have that shrugging or winging of the scapula. The reason this occurs is that when your brain is trying to figure out how to move, it's doing some really complex processing to figure out the best way to achieve that task. So while we might say that something is dysfunctional just because there's a shrug or scapular winging or maybe some sort of movement pattern that we just don't like in the scapula, it actually might just be a normal variant for whatever we were trying to do. And so when we go back and look at that 2-to-1 ratio of for every 2 degrees of movement in the arm, there should be 1 degree of movement in the scapula, there seems to be quite a bit of fluctuation. And so sometimes it might be more 1-to-1, sometimes it might be 3-to-1 or 4-to-1, etc. That probably has more to do with what task we're doing. So if we're just moving our arm up overhead, then it might just be 1-to-1. Whereas if we're lifting up a heavy box off of the ground or doing a shoulder press at the gym, then it might fluctuate and be something else. So it might be 3-to-1 or 4-to-1. And that's just your brain processing the best way to achieve whatever that task was. For the rehab program, we could still stretch the upper traps if they feel tight or do some soft tissue work for them to loosen them up. And we can still definitely strengthen the serratus anterior and the lower traps to kind of help create a little bit of balance for the muscles around the shoulder blade. However, this doesn't necessarily mean that for every shoulder case it's going to be the exact same, nor does it mean that it's actually going to resolve the pain. a poorly moving scapula typically isn't going to be enough to cause shoulder pain. So even if we try to change the mechanics of the scapula or strengthen the serratus anterior and lower traps, loosen up the upper traps, that plays a little role in shoulder pain but doesn't actually paint the whole picture. There's typically more factors involved than just a poorly moving scapula, and so one of the big factors could just be loading. And what we could be doing is just overloading the whole shoulder complex. So when we build a program for rehab, if we're trying to recover from impingement syndrome or a rotator cuff tear, let's say, then instead of just looking at it from a scapular position standpoint of saying, well, the scapula isn't upwardly rotating enough, so let's stretch the upper traps and then we'll strengthen the serratus anterior and the lower traps. Instead, we should just focus on strengthening the shoulder as a whole and treating it as a unit versus trying to just isolate specific components of it. In other words, instead of trying to control the scapula and try to have it always in a perfect position, that when we're rehabbing it, we should really focus on how it's actually going to function in daily life. Thank you everyone for watching another episode of Monday Mornings with Michael. I hope that you found this episode helpful. Hopefully it helps you if you're dealing with some shoulder issues, either rotator cuff tears, impingement syndrome, a tendinopathy of some sort. If you did find this video helpful, don't forget to like it and also subscribe to the channel.